Maya Feller, thank you so much for being with us today. We are so honored to speak with you.
Oh, thank you for having me.
Of course, I just want to go through a little bit of your bio because there's so much to say about what you've done. You are a nationally recognized nutrition expert. You believe in providing nutrition education from an anti-bias, patient-centered, culturally sensitive approach, and you have truly dedicated your work to helping the public make informed food choices that support health and longevity. And also, you are the author of Southern Comfort Food Diabetes Cookbook, which transforms classic Southern comfort foods using diabetes-conscious ingredients. That's a lot. Welcome, welcome, welcome.
Thank you. That's so kind of you. Thank you.
Of course, yeah. I'd love to start with some questions so the IIN community can get to know you better. So, can you shed more light onto what an anti-bias, patient-centered, and culturally sensitive approach means, and why is this so important?
Yeah, absolutely. That's a fantastic question. So when we say patient-centered, it means that the patient themselves are at the center of the collaborative care process. And when we say culturally sensitive, right, we're really talking about providing care from a lens of cultural humility. That means that the patient is the experienced person and they're the expert in their own lived experience, right? Me as the provider, I'm the expert in nutrition, and I have to bring that together so that we can really create a sustainable plan that is unique to the individual. Now, the anti-bias part is really just being aware of my own implicit biases and not letting that influence that care process.
And why is that so important? What have you seen the difference between your approach and perhaps a more conventional approach?
So what I've seen is that, when patients feel heard and respected, then they really are proud of who they are, right? There's so much shame in our society, right? And people feel often blamed for diagnoses that they have. It's not their fault. And it's also not helpful when providers kind of dig it into them. So when we enter into this collaborative care process, they just feel so much better. And then the outcomes tend to be more beneficial.
I love that. And so what inspired you to do this work? How did it start?
Yeah, it's a funny story. I actually, I came to nutrition as a second career, and I come from this very radical home of social justice warriors. And I was training for the Boston Marathon and running many, many miles. And I kept thinking, what's happening to all the food that I'm consuming? I would get to mile 13 and I was hungry and my running partner was in and out of the hospital. And then I thought, maybe I should study nutrition so I can figure out, why we're not doing such a great job of fueling ourselves. But once I stepped into the world of clinical nutrition, it became really clear that as a, Black woman, that I was not only a minority in the field, and I really had this desire to work with disenfranchised communities. And so once I started, I just hit the ground running.
That's amazing. And I want to shift gears for a second. Your cookbook. Can you tell us more about the cookbook?
Absolutely. Which one?
The Southern Comfort. I would love to hear more about that.
Okay, super. So that cookbook is a cookbook for people who are living with diabetes. And basically I'm taking, traditional Southern foods that are kind of, the comfort foods for everybody living in the continental United States. And I transform the ingredients to make them more diabetes friendly so that people are able to continue to eat some of those foods that they grew up with and that they don't have such a negative impact on their blood sugars.
Oh, I love that. Is there a couple recipes you could tell us about or a favorite that you have in the book?
There's a waffle recipe, and it's a combination of almond flour as well as cassava flour, so it's really fiber rich. And then it's savory, so I add in some chives. It's pretty delicious, and I always recommend if you're a seafood eater to have it with a little smoked salmon or caviar if you want to be really fancy.
Oh my gosh, I love that. Oh, man. And so you are fairly new to the IIN community. So first of all, welcome. How has it been?
It's amazing. I mean, this community is so engaged, and people are really here to do this transformative work. And as a dietitian, I find it so inspiring.
And so what do you think, getting into this, that the role of health coaches is in the entire healthcare landscape?
So I tell my RD colleagues, I say we should all have health coaches on our team, right? Because health coaches are really there to do that deep listening work and kind of coach the patient through whatever that disease process is or whatever the nutrition work that they're doing. And so they can be an absolute ally in that team, making sure that people continue going one step forward.
What advice or recommendation would you have for someone that wants to become a health coach or is thinking about becoming a health coach?
Well, the first thing that I would say is do it
Yeah.
unequivocally. And I would say, as you're entering into the coaching process, also don't forget to make space and time for self-reflection and think about how you present and show up in these collaborative care process, right? So like, how will you show up for someone else, right? So you want to heal yourself, but then also how do you show up so that you can really kind of be like a tabula rasa, blank slate for the person that's listening.
That's wonderful. And then I want to leave with one last question that we love to ask everyone. What is one wellness tip that you do or you'd give to someone listening that's super accessible that can be, really life-changing?
My one wellness tip is find a behavior that gets you one step closer to where you want to be. Choose low-hanging fruit. Low-hanging fruit is wonderful because you can replicate it over and over again, and then you feel really good about yourself.
That's so good to get the motivation going.
Yeah.
Absolutely. Well, Maya, it has been an absolute pleasure. Thank you so much for being with us. And on behalf of everyone at IIN, we are so happy that you're part of the IIN family.
Thank you so much for the warm welcome, and I absolutely am enjoying being a new faculty member.